This is Holly. She started coming into us a few months ago with quite a few things going on. In spite of having 2 spinal fusions, one in the neck and one in the lower back, you were still having quite a bit of neck and low back pain.
Very much.
Tell me a little bit about that.
I had a fusion, like he said, in the neck and the lower back, and initially I have degenerative disc disease. Initially it helped. A fair amount of help, I would say maybe 60%, 75%. But by the end of the year, by the end of the first year, that started going down. And my range of motion, it just, the more I moved my neck, the more it started to hurt. The more I turned my back, the more it started to hurt.
Right.
And I ended up in the same position I was in prior to the fusion.
Right.
So it just basically was a redundant surgery.
And that's one thing you said, you wanted to avoid more surgery if possible.
That is exactly the #1 reason I came here to see you, because I actually was told I needed another surgery, and I have had so many joint replacements, multiple, and so many other surgeries over my span of disability, whatever you call it. I'm done. It's crazy.
Understandable.
Doing the same thing over and over, expect a different result.
Right.
That's what I was doing. I got no different results. So I said, that's it, I'm done. And everybody got very nervous. My son was nervous. He calls from California all the time to make sure I'm still okay. I think I'm fine, I'm wonderful. I'm going to New York. But all this fun stuff. But
so instead of another spinal surgery, we tried something a little more conservative, chiropractic care.
Yes.
Tell me how the neck and low back's doing now.
Oh my gosh, my quality of life is unbelievable. It is. I can exercise, and I can exercise not like just initially when they're like, well, you can walk.
Right.
You can walk.
Sure.
And I'm like, well, okay, what does that do for the rest? No, I do, as of right now, I do up anywhere between 300 and 600 crunches a day on my ab lounger. I do waist twists on my yoga ball. I do work on my yoga ball. I do leg lifts, everything. I can be up for 8 to 10 hours a day. I can play with my grandsons at the park. I have so much energy, so much more.
I love it.
Oh, it's amazing.
It's been amazing watching the transformation.
It's unbelievable.
You now, compared to when you first came in, it's night and day.
Oh, it is.
That makes me so happy.
Very
Tell us a little bit about the hands. What was going on there?
The hands. Boy, I wish I would have met you before I had surgery on this one.
Right.
It's doing better though, because the surgery didn't work, but now it's better. This was the surgery they told me I was going to have, and this hand was so much worse than this one. They said that the bone area around the thumb was pinching off all the nerves. I could put lotion on this way, but I couldn't go this way without it just setting me on the ceiling. And I had no feeling in these 3 fingers at all, other than just shooting pain. All through here, same thing, just pain. Don't touch it, don't nothing. And they had an appointment scheduled for me to go in to the hand specialist and set up my surgery. And I just said, no, I'm done.
More.
I'm done, no more. And it hurts when you adjust it. But it feels so good when you're done. And there are times where I know it's out, and I'm like, oh, maybe I could just run in and have him just adjust my hand really quick, because I know it's out. And it hurts, and it feels so much better if he could just pop that back in.
Awesome.
But yes, so no surgery. The arthritis is actually broken up, I think, because I have so much more motion. I have feeling in all my fingers. Even my nails are growing back. I don't know if that's related, but I can squeeze. I can do this. I can open jars.
Huge.
I can use a can opener, a twist can opener. Have not been able to do that for like 4 years.
Awesome.
So yeah.
Huge. Well,
very big.
Sounds like you got your life back.
I got my life back.
Awesome.
I did.